This is not for people of color. This is not for us. Stop it, stop it, stop it. This is not for people of color. Stop it.
Today's video is going to be very interesting. Hey guys, and welcome back again to my YouTube channel. Do you think chemical peeling is good for black skin? Do you think we black people should be peeling our skin with chemicals? Or what do you think down in the comment section? I'm also going to say my own opinion. But first, there is this new peel that just came out. I want you guys to just see how it works. Look at what this peel does to the skin. You'll be amazed. To be honest, just watch.
So you guys have to check out this phenol peel. This is a really aggressive and perhaps one of the most aggressive types of chemical peels that you can do. She's peeling, it's cracking and coming open. This has to be done by a trained professional, and often we actually use cardiac monitoring during a phenol peel. But this is her before. So this is before the procedure, and then this is after the procedure. So you can see that after they peeled everything off, that she's had a lot of tightening, incredible transformation here, but this is risky. It should never be done at home. Beautiful result 21 days after the peel.
Let's talk some more about this peel. This phenol peel is the deepest, most effective type of chemical peel, and it penetrates deeper into the skin layer than other peels like TCA peel, AHA peels. You know, when we want to do normal chemical peeling, we use the TCA, but now this penetrates deeper, and these phenol peels can solve harsh skin imperfection like acne scars, wrinkles, coarse wrinkles, serious hyperpigmentation is going to clear. And the most incredible part of this is that you're only doing it once and you're good to go. Unlike normal chemical peel that contain TCA, AHA, and all of that, you keep doing it once in 2 months, once in 3 months. But this one, only once in your lifetime, and it lasts for decades, and it penetrates deeper. I know you guys have other questions concerning this peel, because since it's penetrating deeper into your skin, hope it's not going to affect your kidney, hope it's not going to do that. I have other videos to play for you. This particular person actually, he explained some questions concerning this peel. But before I play this video, just want to ask you guys, do you think this particular peel would be good on black skin? Do you think?
You guys had so many questions about this amazing transformation for the phenol peel. So let me answer this one first, and then we'll get to some others. The first, the pain. So this would be a very painful procedure if it's not for topical numbing that would be applied 45 to 60 minutes prior to the treatment. But more likely, this individual had injection numbing, so nerve blocks in the face, and then on the periphery some additional numbing to keep her comfortable. If you look at other videos from the clinic that did this, she was in no pain during the procedure. There would be some discomfort following the procedure as the numbing wears off. It's going to look and feel like the worst sunburn of your life, so probably some pain medicine to go was also prescribed. Next up, we're going to talk about the need for cardiac monitoring and perhaps kidney function monitoring for this kind of peel. Chemical peel risk damage to your kidneys or to your heart. This is what a phenol peel will look like after you peel off the dead skin. You're very red. Phenol is carbolic acid, and when you use it on large areas of the body, like more than the face, you can actually absorb enough where it can be nephrotoxic or damage the kidneys, or cardiotoxic, which means you can start to get irregular heartbeats. And so that's why we do cardiac monitoring during a phenol peel, just to make sure a patient isn't absorbing too much. When you're only treating the face, it's rare to have that complication, but this is something you do have to be cautious with. That's why it should be done only with a board-certified physician, preferably dermatology or plastic surgery, who got trained on this in residency.
But first, this peeling looks so scary to me. I don't know, or is it just me? You have to look very, way ugly before you start looking pretty. And although I will say, yeah, it worth it at the end, but I don't know. The pain, the torture you go through just to get that. Anyways, I want to know what you guys think about this particular phenol peel. But first, I want to show you guys what other people think about it. and before I come and talk about the normal peel we're supposed to talk about in this video.
You guys have to check out this Phenol Peel. This is a really aggressive and perhaps one of the most aggressive.
This peel is not for us. That's it. That is all.
This is an example of a phenol peel or a deep chemical peel. I know the video you're talking about because I saw it too. So the thing to know with chemical peels is that there's different degrees of chemical peels or different depths. You can get a superficial chemical peel like at a med spa where you have just a little bit of flaking but really no downtime. You can get a medium depth chemical peel where that's typically followed by about a week of flaking, but not anything near as severe as what I showed you. Deep chemical peels are what really cause a lot of downtime, crusting, weeks and possibly months of redness. While the deeper the peel and the longer the downtime, the better the results. The deeper the peel, also the higher risk of complication. I personally don't do phenol peels. They've somewhat fallen out of favor based on their risk profile. For me personally, I feel like doing a series of medium depth peels is more tolerable for patients as well as my provider risk tolerance. Doing a series of 3 versus 1 giant one. But overall, the main things that chemical peels address include fine lines and wrinkles, texture, and pigment.
Okay, so this peel is what we like to call a phenol peel. It is one of the deepest peels on the market. It's going to help with hyperpigmentation, acne scarring, coarse wrinkles within the skin, but the downtime is crucial with this peel.
I've been seeing videos like this all over TikTok, but a peel that reduces wrinkles like that is actually legit. Let me introduce you to phenol peels and the interesting history behind it. This is Joseph Lister. He's considered one of the pioneers in antiseptic surgery. He dressed an infected wound of a patient with phenol one day just to see what happens. It's the 19th century where anything goes as far as medicine. But surprisingly, the patient lived. This is because phenol had the ability to destroy the proteins that were in the bacteria. And soon that application extended to skincare. Phenol, also called carbolic acid, is a relatively small molecule, which means it's readily absorbed by the skin, where it then destroys a bunch of proteins, basically removing the upper layers of the skin. It takes about 6 weeks to recover, but then the results are astounding. But it's also the riskiest of peels. Phenol is what doctors use to destroy the nail matrix of ingrown toenails. That way they never grow back. But this isn't a new skincare treatment. It's been around for a minute. It's the secret behind Biologique Recherche tonic, dating back to 1970, where it's the third ingredient in the product.
This phenol peel is really expensive, and of course it's not going to be for everyone. A peel that you have to do, and you have to be on anesthesia, you have to numb and start checking your heart. It's dangerous, so it's dangerous. Anyways, let's talk generally on chemical peels for black skin. My own opinion, I feel like why people say chemical peeling is not good for black skin or it's not for skin of color is because naturally it produces melanin, and the more you peel out that melanin off your skin, it keeps coming back. So what I would say is that I won't say it is bad for black skin. Chemical peeling generally, maybe TCAP is bad for black skin because when you have some treatment like hyperpigmentation, melasma, serious ones though, you need to peel that skin off. You need to take it off, and it's the after treatment that determines your results. Not even the treatment itself, not even the peeling. It is what you put on your skin after your skin is peeled. So, me personally, if you ask me, I don't like peeling my skin. It is not something that I love doing. But there are some treatments that there's some skin condition that you have that the treatment alone is only to peel your skin. So, I won't say peeling the skin is bad for skin of color. It can be totally bad for skin of color. So, I don't know. I just want to know what you guys think down in the comment section. Do you think it's good for us or it's bad for us generally? Anyways, my name is Maria David. I'm a content creator based in Lagos, Nigeria. And thank you guys so much for sticking around to this point. And I'll see you guys in my next one. Bye.